3RR, and we have our first guest for today in the studio. It's Ben Buchanan. He is from the School of Psychology and Psychiatry at Monash University. Welcome to the studio, Ben.
Thank you. It's good to be here.
Now, you work on a very interesting area, but one that a lot of people wouldn't be aware of specifically. It's called dysmorphic disorder.
It's body dysmorphic disorder. Yeah. It's actually a mental disorder where people think that they are incredibly ugly, even though they look normal.
So, I mean, we hear about a lot of disorders, physical disorders all the time. I mean, we hear about anorexia and so forth. How prominent is this compared to those ones that are commonly referred to?
Yeah, well, everyone seems to know about anorexia and bulimia. But interestingly, body dysmorphic disorder is 5 times as prevalent as anorexia. So it affects between 1 or 2% of the population, which is actually quite substantial given that no one's really heard of body dysmorphic disorder. That 1 or 2% of the population is more than other disorders as well, like bipolar disorder, schizophrenia. So it's a relatively common disorder, yet no one's really heard of it.
Now, when we talk about these disorders, everyone can imagine at times they go through their life and they have these ideas that they don't look great or so forth. I mean, what distinguishes people? Everyone in the studio just put their hand up, folks.
Yeah.
But how is that distinguished from this? I mean, what are the differences you see in patients?
So most people, especially during the teenage years, go through a period of thinking that they're not attractive and a degree of self-consciousness, maybe checking in the mirror a fair bit. I suppose what differentiates body dysmorphic disorder than these more transient concerns is that they really significantly affect the person's life. So they might stop going to school because they think that everyone in their class is looking at them and thinking that they're ugly. They might stop going to work because they're too afraid to be exposed to new people that might judge how they look. Or their relationships might suffer, so they might find it difficult to socialize, even with people that they've known for quite a long time, because they're constantly thinking that the person is looking at them thinking, oh my gosh, they're really ugly.
Does body dysmorphia focus on particular body attributes? Like, is it, someone who doesn't like the shape of their nose or how long their toes are, or is it just a holistic kind of sense of not looking normal?
It's usually focused on 1 or maybe 2 areas of concern. So you mentioned the nose. The nose and the face is actually the most common site of preoccupation. They might fixate on, say, their skin on their face, or there might be a sense of that their face isn't symmetrical, and this can be really concerning for them. But it can really be any part. It can be to do with the breasts, the bum, the legs, the toes, as you say. So the preoccupation could be about any aspect of appearance. Interestingly, the prevalence of body dysmorphic disorder is the same in men and women, or slightly more in women, but roughly similar. But men tend to focus on different areas. So men tend to focus on not being muscly enough, whereas women tend to focus on a facial feature.
Now, Ben, you've been looking at this in a very specific way, and that is through brain imaging, because people must think, is this a self-esteem issue? Can you just talk a person through this? I mean, you're a psychologist, so, can you talk a person out of this? What's the brain imaging telling you about this particular disorder?
Well, I think it was really important to do the brain imaging because there is this sense that, it's just sort of like vanity. It's just sort of a self-esteem issue. And so what we wanted to do with the brain imaging is work out what's different about the brain in people with body dysmorphic disorder. And this is really important because it can tell us why the treatments that we do are working. So cognitive behavioral therapy, which is a talking therapy where you talk the person through their issue, we know that works. And doing this brain imaging can tell us, okay, what is the brain area that actually that treatment, that therapy is targeting?
And what do you see? I mean, is there a difference in brains? Like, could you put a person in the scanner and say this person has this disorder as a result of what you're seeing?
It's not quite that accurate. So what we did was we got I met 20 people with body dysmorphic disorder. They told me their stories, and I and agreed to be put in an MRI scanner. And we also got 20 healthy controls. And so when we compare the 20 people with body dysmorphic disorder and then 20 controls, then we can see a clear difference. When I was first analysing the data, I was particularly interested in the part of the brain called the occipital lobe, the area at the back of the brain associated with visual perception. But an interesting finding was that this area is actually largely normal in body dysmorphic disorder. But the major finding was that in body dysmorphic disorder, the emotional region of the brain and the rational region of the brain, they really weren't communicating with each other.
There are some other disorders, like even autism, where people can't quite comprehend a face with that emotional connection like they should, or people who are face blind even. Are there any similarities in like what you're seeing with body dysmorphic disorder and some of these other conditions?
Well, there are people that are face blind, and I think that body dysmorphic disorder might be on the opposite spectrum, because they are so preoccupied with facial features, and they actually misinterpret a neutral facial expression as a really angry or contemptuous one. So they just think everyone is looking at them in an angry fashion.
Ben, do people with body dysmorphic disorder, do they see other people with the same level of attractiveness as everybody else does?
They tend to be a bit critical about other people. So, as I was interviewing people for my research, it became obvious that some people were really scrutinising my nose or my ears.
They're fine, by the way. They're fine.
They are. They're
I can't see your ears currently, but yes.
And so if they're preoccupied with their own facial feature, they tend to really scrutinise other people in the same way.
Interesting.
So with these MRI results, do you know if it's cause or effect, or is it something that was pre-existing that puts these people more at risk of body dysmorphia, or do you think that it's sort of a downstream effect of having body dysmorphia in terms of the changes in the brain that occur because of the condition?
Well, I'd say it's a little bit of both, but mostly there is data to suggest that people have a predisposition to develop body dysmorphic disorder. So, for example, if someone in your family has the disorder, you're more likely to get it, and that might be to do with the brain's made up of white matter and grey matter, and it looks like that there's compromised white matter in the brain before the onset of the disorder. So it looks like it's the brain differences are actually a predisposing factor, but the environmental effect is also really important. People with body dysmorphic disorder report higher levels of childhood neglect, teasing and bullying about what they look like in childhood, and all these things that we know causes people mental distress. People with body dysmorphic disorder are predisposed to it, might be more vulnerable to those events.
Ben, that brings me to a question that I was sort of thinking of just before. How long does it take a person to get to this point? Is this something that, a year of bad schooling, and sort of inappropriate social behaviour at school means a person has this condition at the end of that year, or is this something that takes 10, 20 years to build up?
Well, the onset is usually at 15 or so years of age, or so adolescence, and it's really difficult to say that after a year of teasing someone would develop it. But what generally happens is once someone has the disorder, they don't receive treatment because they don't seek treatment, and then their concern about their appearance ends up being quite chronic. So because they think that there's actually a physical defect about them, they're not likely to visit a psychologist or anything. They're likely to visit plastic surgeons to try and fix it, but they're not likely to think, okay, I've got an emotional problem, I need to gain support for that.
Is this something that I know, my personal experience is as I've gotten older, I haven't given a crap as much about how I've looked. You lose your hair,
no
things
way.
happen. Oh, it's hard to tell, I know, but it's true. Do you see a decline with some people in their symptoms and so forth as they do get older and they get more perspective in life and so forth, and realise that the cosmetic firms are just trying to brainwash us all and all this sort of crap? I mean, does it get better?
Yeah, without treatment, it does remit in some people. But if they don't get treatment, usually the people have the disorder for about a decade or two before getting better. So it's a long-term thing.
Yeah.
But if they do get treatment, they can remit from it. They can improve within a year. Yeah.
Ben, great talking to you. It's a really interesting area and very interesting to hear that it's so much more prominent than these other well-known disorders that everyone is aware of. So something for people to keep their eye on. Ben Buchanan from the School of Psychology and Psychiatry at Monash University. Thanks for being on Einstein A Go-Go.
It's a pleasure.
We're going to take a break, folks, and we'll be back in just a few minutes. I believe Dr. Jennifer Henry will be calling in from the New York Academy of Sciences.
I'm only interested in true love. Is that just way too much to ask